We begin this morning with some sad news. Former President Joe Biden has been diagnosed with an aggressive form of prostate cancer that spread to his bones. According to a statement from his personal office, Mr. Biden was seen after experiencing urinary symptoms, which led doctors to find a prostate nodule. The statement goes on to say that the cancer appears to be hormone sensitive, which allows for effective management. The president and his family are reviewing treatment options with his physicians. Let's go right now to CBS News White House reporter Aaron Navarro for more on the former president's diagnosis. Aaron, thanks so much for joining us. What do we know about the former president's condition?
Michael, good to be with you. Yeah, from what we know, at least from the former president's office, as you mentioned, him and his family are reviewing treatment options with his physicians. And just to lay out the timeline on what we know so far, last Tuesday, we had been told that during a physical exam, doctors found a small nodular growth in the prostate of former President Biden. At the time, they said further testing would be done to determine if it is cancerous. And we found that out on Friday, where his office says he was diagnosed with prostate cancer that had grown to the bone. In that statement, they say it was in a severe category, grade group 5, is in a, quote, more aggressive form of the disease, but that the cancer is hormone sensitive, could be responsive to testosterone blocking treatment. His physical results as president in the last few years had not mentioned anything regarding his prostate, though CBS News did find from 2019 records put out from his campaign the month before he was inaugurated that said he had been treated for, quote, benign prostasis hyperplasia and was treated with surgery. Any mention of his prostate was not mentioned again in further records during his time as president.
So, Aaron, what's been the reaction from political leaders both on the left and the right?
Yeah, primarily messages of support so far from some of the notable leaders. Former President Barack Obama, who Joe Biden, of course, served as vice president to, said that he and former First Lady Michelle Obama are praying for his recovery, noted Biden's work in that, quote, cancer moonshot initiative during President Biden's time as vice president and eventually in his time as president, where he really spurred innovation and research into curing cancer. President Donald Trump, political foe, of course, of Vice President Joe Biden, said that he and First Lady Melania Trump are saddened to hear about the diagnosis, extended best wishes to the family. And Vice President Kamala Harris, who we know late last year replaced Joe Biden on the Democratic ticket, said that she and the second gentleman at the time, Doug Emhoff, are keeping President Biden in their prayers and said, quote, Joe is a fighter, and I know he will face this challenge with the same strength, resilience, and optimism that have defined his life and leadership.
And Aaron, quickly now, Biden faced a lot of concerns over his health in the campaign in 2024. How does this new diagnosis factor in?
In the backdrop of all of this is a new book coming out this week that talks about the alleged cover-up on his health and his aides and team shielding that from the public. And this topic on Biden's health, believe it or not, has appeared in the 2028 race as well, where you've seen notable Democrats like Pete Buttigieg, Illinois Governor J.B. Pritzker being asked about President Biden's health and whether he should have run for a second term.
All right, Aaron Navarro, thanks for joining us. For a closer look into Biden's diagnosis, let's go to Dr. Vipul Patel. He's a prostate cancer surgeon and professor of urology at the UCF College of Medicine. Doctor, thanks so much for joining us. Now, the former president's cancer has a Gleason score of 9. Can you explain what that means?
Yes, thank you. The Gleason score is a measure of the aggressiveness of the tumor, and it's performed when you get a biopsy of the prostate, which was apparently done quite recently. And this is a score of how aggressive it is, 9 out of 10.
Doctor, what treatment options are there for situations like this?
Well, it depends really on when you find it. If the tumor is organ confined, then there are many surgical options, radiation options. In this case, with the former president, it appears to be metastatic to the bone, and therefore a late diagnosis. And often surgery and radiation can often be ruled out, and you start as a primary hormonal medical therapy in order to control the cancer, because obviously it's already left the organ.
Now, doctor, we heard in the statement from the former president's office that the disease has spread to his bones. What does that mean? What's the significance of that?
when a cancer spreads to the bones, it's defined as being metastatic disease. We don't know how effective that is in terms of how many bone lesions he has, so we don't know the extent of that. But what we do know is that that makes it a very aggressive form of cancer. And we also know that that often takes time to happen. So this may have been something that has been progressing over years, and they've just found it now.
Now, we can't avoid talking about age, such a big factor when we're talking about cancer. And so Mr. Biden is 82 years old. What's the prognosis for a man his age typically?
I think his prognosis is really going to be dependent upon the genetics of the tumor. At 82, he's not in poor health, um, but obviously the therapies would have more effect on him potentially. Many of the medical therapies are quite effective these days and give patients longevity, even at 82 with high-risk prostate cancer. Depends how sensitive this cancer is genetically to the treatment they give him. But the nice thing is we do have many different types of medical therapy we can use today. So the prognosis today is much better than it would have been 5, 10 years ago.
All right, Dr. Vipul Patel, thanks so much for giving us your perspective. We appreciate it.
Thank you.